All right, very, very good, and look forward to that also. Well, right now we are joined by Matthew Worley. Matthew is a nurse practitioner from CHI Memorial's Chest and Lung Cancer Center. Matthew, good morning. How are you?
Good morning. How are you?
I'm doing great. So this is November is Lung Cancer Awareness Month, and I want to talk about that. So let's talk about a lung CT, and then also who should get it.
Yeah, so lung screening is important for a lot of folks, especially those who are at high risk for developing a lung cancer. So those are people with a significant smoking history, patients that are ages 50 to 80 years old with what you call a 20-pack year history. So a pack a day for 20 years, any type of significant length of time you've been smoking, you'd be at an increased risk of lung cancer, and they would recommend that you have a lung screening. Lung screening is simply just a scan of your chest, same as you'd have done at the hospital, but we've got a mobile truck with a CT scanner on it that travels around to the communities, does these life-saving scans, is able to see heart disease, lung cancer, all these things detected early when they're still able to be, treated well. And the bus is actually going to be at the Publix down here on Paul Harf Parkway on Friday, November the 7th from 9 to 3. And then we'll also be at Nutrition World Saturday the 8th. That's actually National Lung Screening Day. We'll be at Nutrition World 10 to 2 and, be celebrating the lung bus and lung program and have a big crowd over there for a health fair. So those will both be great events coming up.
Big events coming up. We're joined by Matthew Worley, nurse practitioner, CHI Memorial Chest and Lung Cancer Center. I want to mention something here. I read a report recently that non-smokers getting lung cancer is also up.
Yes.
And I've got some friends of mine dealing with that right now. Talk about that just for a moment. What are you guys seeing as it pertains to that?
Well, so we've had a big uptick. Historically, we were only scanning people who had smoked for a long time. Now that the scan is able to see more and do more, especially with calcium scoring for your heart and just being able to see everything in your chest, we've had around 20% of the people we scan are non-smokers. They've never smoked. But smoking isn't a requirement for lung cancer. Dr. Hedrick says all the time, if you have lungs, you can get lung cancer, and it's something that needs to be assessed. You potentially wouldn't be scanned as often. If you are a smoker, meet those high-risk guidelines. They recommend getting scanned every year. If you're a non-smoker, they wouldn't recommend it as often, maybe every 3 to 5 years, just to monitor your calcium score, make sure nothing's developing in your lungs. But yeah, definitely don't have to be a smoker to get cancer. Everybody, over the age of 50, we recommend doing it. There's insurance coverage for people that meet, the guidelines who have smoked for a long time. But if not, you can always self-pay. It's $150. That covers the scan, the calcium score, radiologist reading it, and getting all the info to you in your primary care.
We're joined by Matthew Worley, nurse practitioner, CHI Memorial, and they're specifically the Chest and Lung Cancer Center. All right, let's talk about this. So how does it work when people come in and get their lung CT?
Yeah, so the great thing is a convenience factor. Appointments on average last about 10 minutes. So if you call and schedule, our number is 423-495-5864. It's 495-LUNG. You can call our office, have an appointment. If you have an appointment, it makes the process a little quicker just getting in and out. But if you happen to see the bus out somewhere, our bus is out 5 days a week going up and down I-75 and all around this area. So if you see it and it's parked somewhere, go knock on the door, and they can call and get you an appointment. You're in the bus for about 10 minutes. The scan itself takes about 90 seconds. You're in and out of there. People always joke, if I'm laying down, can I take a nap? And it's like, you're not in there long enough. You're in there just long enough to get the scan. You're out the door. You're getting results the next day. We're sending phone calls or texts, and then you also get a link to what's called MyChart. It gives you access to read your radiology report, so that way all your information is available to you within a few days.
Well, that's wonderful. And so you just talked about it, but give me a little more about what it shows.
Well, so it shows everything from your collarbone to just under your rib cage. So mainly looking at the lungs, that's the main area they're trying to get. But of course, everything else that gets pictured in that area, your heart does calcium scoring for your coronary arteries. They measure your aorta, the main blood vessel coming off the heart to check for aneurysms. They see the lower portion of your thyroid, and then in your abdomen, they see your gallbladder. If you have things like gallstones, biliary obstructions, things like that. Your liver is on there. If you have any cysts, your esophagus, stomach, all those places where a cancer can grow and you can't feel microcephalum. That's why this early detection is so important, because with lung cancer, historically has been a death sentence. It's 18% survival rate, and that's, there's not a whole lot you can do about that. But when they're found on a screening, stage 1 lung cancer, especially stage 1A, have around a 90% survival.
Wow.
And so the great majority of the cancers we find on the lung bus are stage 1 cancers, around 80% of them. So these are people that if they hadn't got the screening, they wouldn't be around in another 2 or 3 years, but they're being able to be treated, lives being saved. And just for other things that you're seeing, just in the last year, we've diagnosed 2 breast cancers, 2 renal cancers on the kidneys, and then a liver cancer as well. And all the breast and the renal cancers were all 4 stage 1s as well that were able to be surgically resected. And so those are just things you see and you don't know till you look. So that's why we definitely recommend doing it.
There is no reason not to get this done.
Right, absolutely.
I mean, it really is not. All right, so once again, it's nurse practitioner Matthew Worley with CHI Memorial's Chest and Lung Cancer Center. If you will repeat the details about where you're going to be here in this area, when, and then how people get more information.
Absolutely. The bus will be at the Publix on Paul Huff Parkway. That's this Friday, November the 7th from 9 to 3. And then Saturday, the 8th, will be at Nutrition World off of Lee Highway from 10 to 2. But of course, they can always call our number, 423-495-5864. The bus is out 5 days a week all over Tennessee and North Georgia. So just call in, let them know where you live, and they'll find a place for you.
Matthew, it's a pleasure meeting you. Thank you for what you're doing. Tell my friend Dr. Hedrick hello for me.
Yes, sir.
And a big thanks to Karen Long, who sets these interviews up and does a tremendous job on that. Thank you very much, and we really appreciate our friends with CHI Memorial. It is 8:31.